Good morning, students. Today, let us see regarding the new topic, that is NRHM, National Rural Health Mission. So it is one of the new program initiated by Government of India. So under this particular unit, delivery of health services, various health services in India, we have to study the national health programs also. So we are going to study few programs under this unit, and we have a coming unit with full of national health programs. There we will be continuing with the other national health programs. So today let us see regarding NRHM. This particular topic is available in your KPAR textbook in page number 469. Page number 469. So you all can follow the textbook. Even you all have to read the textbook. It is very clearly given in the new edition of your textbooks. So as I have told, it is one of the new initiative of the Government of India in order to provide effective healthcare, especially focusing upon the rural population. This program is especially focusing on rural population, and it is more emphasizing on 18 states who are having very weak public health indicators. So yesterday we have seen what are the health indicators. So weak health indicators in the sense these states, they perform very low in the health aspect. They have high morbidity and mortality rates, all the problems they will be having other than comparatively with the other states. So main focus is given to these particular 18 states. The main objective of NRHM program was to decrease the infant mortality rate and the reduction of maternal mortality rate as well, and it really provide access to public health services for every citizen. That's what this program aims to bridge the gap between the urban and the rural health services. As we all know, the rural area is having less infrastructure. So they are trying to reduce this problem by creating a cadre who is known as ASHA, that is accredited social health activist. Through here they are trying to reduce this gap between the health services provided in the urban and rural area by emphasizing more on the rural areas. They try to prevent and control various communicable and non-communicable disease also under this program, and regarding control of population, and they try to have gender and demographic balance. All these things are the objectives of NRHM program. And one of the main thing is they would try to bring back the traditional system of medicine, that is the Ayush, back into the government stream. So in the last classes I have told you, Ayush has been it is coming back into the government system by making at least one Ayush practitioner in the public sectors. Either in the PHC, CHC, you will be able to see at least one Ayush practitioner. So the mission of the NRHM program is to improve the availability and the access of quality healthcare for the people, especially those who are residing in the rural areas, especially focusing on women and children. And it really provide the basic by giving importance to the determinants of good health, like nutrition. They focus on nutrition, they focus on sanitation activities, they focus on hygiene, safe drinking water, all these things. And as I have told, they try to bring back the main stream, that is the Indian system of medicine, into the mainstream of medicine. And the mission of the government is to raise the public spending on health from 0.9 percentage of gross domestic product to 2 to 3 percentage. So till now the government was providing less amount for health, but after this program, after this implementation of NRHM, the government emphasized that there should be a raise in providing the fund towards the health sector as per the gross domestic product. The plan of action, especially emphasizing on the imbalance in the health infrastructure, as I have told, between the urban and rural, and they pool all the resources, whatever is needed, and they integrate all the structures and the health manpower. And they would try to decentralize the health infrastructure by making the CHC and the PHC more strengthening. So they would try to make so much of operationalized CHCs into the functional hospitals. So they want to strengthen the PHC and they want to strengthen the CHC also. So the strengthening of PHC will lead to so many first referral units. That means the PHC will be upgraded to a CHC level, and the CHCs can be upgraded to a functioning hospital level under the standards of IPHS, Indian Public Health Standards. So some of the key components were, as I have told, they are creating one person as a backbone in the rural area for the infrastructure development. That is the ASHA, female health activist. ASHA, the expansion is accredited social health activist. So she is a female from the particular area who is having the qualities of good communicator and a good leadership quality from the particular village. So should be a person who is residing in the village, so that she will be knowing well about the particular area. So each village will be having at least one ASHA. So one ASHA, she comprises the population of around 1,000 population. For 1,000 population, there should be at least one ASHA as per the government norms. Then they have a committee, that is a health and sanitation committee at the panchayat level, and they try to strengthen all the rural hospitals, as I have told, under the norms of IPHS. There is the integration of health and family welfare programs and the funding. So the fund which is coming for all these things are merged together and they are providing. So family and health and family welfare programs and various communicable and non-communicable disease programs and the sanitation, these all things merge together, and they really make the traditional system back into the mainstream with the help of Ayush practitioners. And they focus upon sanitation, hygiene, nutrition, and safe drinking water through the district plan for health. So it seeks the decentralization of programs. What do you mean by decentralization? Making the programs to reach into the periphery more easier. So whatever is given through the central government, it should be reaching into the state government, and from there to the district, to the block, and to the panchayat. So such that it should be decentralized, then only it will be reaching into the needed people in time. The goals of this particular program is the reduction of infant mortality rate and the reduction of maternal mortality rate, and they access the public health services such as women health, child health, and as I have told, water, sanitation, hygiene, immunization aspect, nutritional aspect, and the prevention and control of various communicable and non-communicable diseases, including all the locally endemic diseases. And they focus upon the primary health care should be improved and providing comprehensive primary health care, so that the rush in the tertiary center can be avoided. So if we strengthen the periphery level, that's a subcenter and the PHC, really it can act as a first referral unit. Then population stabilization should be controlled by various family planning activities. Then gender and demographic balance should be maintained, and bringing of Ayush and promoting various healthy lifestyles in the among the population. The core strategies are like training and enhanced capacity of Panchayat Raj institutions. As we all know, Panchayat Raj institution is the basic trier system or the basic grassroots level of administration. So if we strengthen them, then only we'll be able to have a good control and management over the public health services. So it should be strengthened enough. So the training should be taken for that. And the ASHA, accredited social health activist, she should be promoted in all the activities of sanitation, everything. So she will be acting as a bridge between the population and between the government. So if there is any problem among the general population, she will be the mediator who is bringing it into the notice of medical officer. Then the health plan for each village through the village health committee. A village health committee should be established in each panchayat, and there should be strengthening of sub-center as well, and the strengthening of all the PHCs and CHCs by improving their bed strength also. And the various implementation activities, like we have to have a intersectoral approach with the district health plan also. So we cannot stand only with the Panchayat Raj institution. They should have a good tie-up with the district health plans, and which is working under the district health mission. So under that, they have to give more importance on drinking water, the sanitation, nutritional aspect, everything. And the integration of the activities with the health and family welfare programs at the national level, state level, block level, and even the district levels. So when we have an integration of all these areas, all these different levels, then only there will be a proper development in the grassroots level. Then we have to strengthen the activities such as data collection, like outreaching services, monitoring and supervision. Everything should be strengthened for better. And especially like non-profit sectors, they also should be incorporated. That is, the NGOs also should be incorporated into the stream for a very good further development in the grassroots level. The supplementary strategies are the same thing which we have already explained. So what they really supplement is the private sectors, as I have told. So with a reasonable rate, they can incorporate the private sectors as well as, and the public private partnership, we can call it as PPP, public private partnership. It should be encouraged in order to attain the public health goals, and the mainstreaming of Ayush back into that, so that the number of doctors will be merged together. Not only the allopathic doctors, will be getting the Ayurvedic doctors, will be getting the Ayush practitioners, everything will be merged together. And the risk pooling should be done, that is through social health insurance. So health insurancing should be encouraged in the local level. So the government is providing so much of funding for such type of insurances. So many areas the people are not aware about the funding which is given by the government. So it also should be merged together. And let us see the plan of action. So in the plan of action, the first one is Asha, as I have told, accredited social health activist. So she should be a person from the particular panchayat, and she should act as a bridge, and she should work along with the ANMs and the Anganwadi workers. So in the textbook it is very clearly written that what is her role along with Anganwadi workers and what is her role along with ANMs. So you all should have should have a thorough reading about this topic, because sometimes even for 5 marks they will ask only about Asha. What is the function of an accredited social health activist? Last day we have seen regarding the job descriptions of various members. So in this particular topic, take it as an assignment. You all have to read the textbook Asha, because it is self-explanatory. You all have to read the textbook. What is the function of Asha along with ANM, and what is the function of Asha along with Anganwadi worker. And she already in that she is provided with so much of drug kit. She is provided with drug kits, and she is getting a training of minimum 23 days, and she used to get this training for a period of whole year. So it is the central government project where they focus upon the training of more number of Asha workers, so that everybody, all the states will get the benefit of Asha. Especially the focus will be on the same 18 states which we have already discussed. Next is the strengthening of sub-centers, as I have told. First one is creation of Asha. Second one is strengthening of sub-centers. So here also the sub-centers, they all are provided with a local funding of 10,000 rupees per annum. And this funding will be in a joint account with the ANM and the Sarpanch. Sarpanch means the local leader of the particular panchayat. So like panchayat member we can tell, or the panchayat president. So that particular local member, they all will be having a joint account, and it will be put into their accounts, and it can be operated by them for the village with the help of the village health committee. So especially they focus upon the supply of drugs, the essential drugs in the sub centers, and they would try to add additional multi-purpose workers if it is needed, or if there is any need of additional ANMs, they can be asked from the government for more ANMs. So such we can strengthen the sub centers also. Next component is strengthening of the PHCs. If the strengthening happens from the periphery, that is the strengthening of sub centers, strengthening of PHCs, then only we can get a good number of first referral units. As I have told, these PHCs are trying to be made into the first referral unit. So in the last classes we have seen what are the basic elements needed for a first referral unit, like a 24-hour service should be there, operation theater should be there, blood storage facility, all the diagnostic evaluations, all the pharmacy availabilities, waste disposal system, everything should be available. So they are trying to strengthen this primary health centers. Next is the strengthening of CHCs. So CHCs at present they are the first referral care unit in our country. So when we strengthen more number of CHCs, we can really improve some of the CHCs into the hospital levels, to the running hospitals like rural hospitals. So this can be done with the help of government by making it into more strengthening levels, by provision of various doctors, anesthesians, and they have to improve the number of staffing patterns, and they can work along with the stakeholder committees like Rogi Kalyan Samiti, especially for the hospital management. So they all collaborate and work together for the development or the strengthening of the community health centers. Next is the district health plans. So the district health plans, really what they are emphasizing is they are emphasizing on the cleaning aspect, like the overall development, that is towards focusing towards the water supply, sanitation and the nutrition, and the hygienic aspect and the sanitary aspect of the various areas coming under the particular district. So they have a district health mission who is monitoring all these services. The district provides a platform for the planning, budgeting and implementation of these programs. So the funneling of the fund, as I have told, so much of fund is coming, so this all should be funneled through the district services. From the district only it is reaching into the other periphery areas. So this funneling concept should be done here only. All the vertical health planning members, like health and family welfare programs, and in the state level and in the district level, they all should merge together into a district health mission. So under the like NRHM is, we can tell, a part of the district health mission. Nowadays the NRHM has been converted into national health mission. So national health mission, then it becomes state health mission, then it will be a branch of district health mission. So these all things comes in an organizational manner, then only there will be integration of the work in various sectors. Next is converging sanitation and hygiene under NRHM. So as I have told, under the NRHM they are trying to incorporate all the aspect of sanitation and hygiene also under one umbrella. So not only they are trying to strengthen the PHC and CHCs, they would try to cover the sanitation and hygiene aspect also with the help of various IEC activities. What is IEC activities? That is the health education activities, that is information, education and communication. That's the same thing, like mass health education, through the help of mass health education, through the help of total sanitation campaigns, TSC, total sanitation campaigns, and with the help of various IEC activities, by promoting all these things even in the school health program. They have to tell all these things in the school health program regarding the public health also. So the household toileting facilities should be encouraged here, and the women sanitary conditions should be encouraged here. These all things should be given high focus under the sanitation and hygiene, which is covering under the NRHM. Next component is strengthening the disease control program. It is also one of the component, as I have told. So here they focus upon especially the communicable diseases like malaria, tuberculosis, kala asar, filaria, all these things they provide. So they have a total integration of the programs, national disease control programs. So it really strengthen the backbone of the periphery areas in order to prevent all this disease control, especially focusing upon the communicable diseases. Even they have a non-communicable disease aspect also, and the disease surveillance system also should be strengthened, and the supply of even basic elements or basic drugs through the allopathic and Ayush system. These all are one of the component. The next component is public private partnership, as I have told. So it is very good for the development of the public health goals attainment, and it really regulate the private sectors also. So you don't think that everything is going to be privatized. Here in this platform, the government would try to merge all the private practitioners also into the platform, so that because we know we have a huge population. So in order to bring up the demands, or in order to meet the needs of the population, the public private partnership is highly needed. So here comes the importance of public private partnerships. The next component is the health financing mechanism. So like here, as I have told, the funding is directly, or 100% funding is from the central government. It's a 100% funding program of central government. So here the finance is controlled by the central government, and it is distributed through various channels, like towards the state. Few fund are given to the district, and few is given directly into the periphery level, into the Panchayat Raj institutions. So such type of new finance mechanism is pulled into the system of health sector through this NRHM program. So we can see that especially in the district levels, so mainly the funding used to be merged over there, but here from there itself the fund is again going into the periphery levels also. Like we have seen the funding of even 10,000 per annum, it is directly going into the local leaders and the ANM in a joint account, so that for the community development or for the other sanitary services, they can utilize that particular fund. And even at last, the IRDA, that is the Insurance Regulatory and Developmental Authority, they really they will approach, they should have a promotion facilities along with CBHI. What is CBHI? Community Based Health Insurance Scheme. That is what I was telling about. There are various health schemes which are working under the community level, so they all have to incorporate this, and there will be periodic evaluation of this community based health insurance schemes by the IRDA, that is by the Insurance Regulatory and Developmental Authority. And next one is reorienting the health or the medical education to support the rural health issues. As we all know, we have so much of medical colleges, or we have a very big medical education system, but the thing is how much it is oriented towards the rural health. So we have to merge all the services towards focusing on to the rural issues. That's why they have merged so much of changes in the medical system, telling that after the MBBS course, at least they have to work in a rural area at least for 1 year before their post graduation. So such type of things has been merged into the platform, so that the strengthening of the rural area can be much easier by reorienting the health and medical education. So these are all the components of various components which is coming under the NRHM program. You all have to read the textbook as well. Then the various institutional mechanisms which is coming under NRHM program is given over here, that is which is already we have discussed. That is the, as I have told, the state health mission, then the national health missions will be merged into the state health mission, then it will be coming as the district health mission. Then it will be coming in integration with the Rogi Kalyan Samiti. Then they have the integration with all the sanitary samitis, all the people those who are working there in the grassroots level, like Asha worker, Anganwadi worker, all the ANMs, everything. So this is about the institutional mechanism, how it is working. And the technical support is also provided from the various areas. Like we can tell some of the examples, like population research centers and regional resource centers, and we have State Institute of Health and Family Welfare. So they all merge together to provide the technical support, because for any activity technical support is highly needed, because nowadays we all know that all the data has to be centralized. So the technical support is highly essential for a proper working at all levels, that is at the state, national, state, district and the sub-district levels. In the coming class we will be studying more about the management of health information system. Management of health information system will be further studying in the coming classes. The role of state governments under NRHM. As I have already emphasized, the state government has also a proper, since it is a 100% centrally sponsored scheme, you don't think that states don't have a function. State also have their own focusing function upon that, especially 18 states, those who are highly focused, as we have already discussed, they will be having major role by the state governments. And the other state also will be having the funding interventions, like ASHA, the funding of the ASHA will be provided by the state government, and program management unit and the upgradation of the CHC, PHC, these all fundings will be managed by the state government. But all the key funding for the 18 states will be given directly from the central government. All the other states, there will be a minor control only by the state governments. Focus on the northeastern states. So even though among 18 states we have studied, again they are more focusing upon the 8 northeast states, because we have to really bring up these particular 8 states to bring back into a very good developmental stage. So when we compare the growth of health infrastructure all over in the India, these 8 states are in the last category. So really they have to develop, like these 8 states, which includes Assam, Arunachal Pradesh, Manipur, Meghalaya, Mizoram, Nagaland, Sikkim and Tripura. So this state should be given special focus. So around 10% of the total funding or the empowerment of the mission is focusing upon the this particular 8 states. So we can see how much importance government is giving towards the low performing states through this particular program. And as we all know, the role of Panchayat Raj institutions also, I have already explained. So through the Zilla Parishad in the district level, some of the administrative things you may not be understanding now, because we have not studied the health organization. The health organization, that is the central level, state level, district level, this all health organization system will be dealing by Sister Smita in her particular unit. So a little later it will be done for you, so that after that particular unit you will be getting the whole aspect, how it is centralized or how it is decentralized, the administrative activities. And we have already discussed the role of NGOs also in the mission. The NGOs are also incorporated into this particular mission, so that a smooth working should happen in all the sectors. And the mainstreaming of Ayush also we have seen, like Ayush also has been brought back, and it really energizes the health infrastructure of the public sector. Finally, the monitoring and evaluation. So among all these things, merging all these things, the NRHM program is really focusing upon the real development of the rural infrastructure, especially the periphery areas. They are more focusing upon, and they focus upon the 18 states, especially the last, which we have told, the 8 particular states in the northeast region, in order to develop their health status towards the development of the country. So in the monitoring and evaluation, as I have told, HMIS, health management and infrastructure, this we will be studying in the coming class, so that you will be having a more clarity. So this health management information system, they try to monitor all the evaluations. So they try to enter all the things whatever they are doing, and their final evaluation will be done, how much the programs are implemented. So even in the sub-center level, even the district level, and every areas, there will be evaluation. So we have district health missions, and we have annual district reports, which is prepared by the government and the NGO in a collaboration, so that they all have to present these reports in front of the state government, and the state government should give a detailed reporting towards the national level. So this is how even the evaluation also happening. So you don't think that if a national health program is being started, it has a lot of activities to complete. From the point of planning till the point of evaluation, they have a lots of steps to continue with. So I hope you have just got a basic idea about National Rural Health Mission, and in the coming class we will be studying in detail about the health management information system. Thank you all.